So we have a number of things that we can do in the office just based on physical examination to determine what's causing your pain. We bring the arm up in front of you is indicative of many types of rotator cuff problems. We can push and actually touch the part of the shoulder that's painful. It could be your rotator cuff, it could be your AC joint, it could be your biceps tendon, it could be a lot of things. We'll take an x-ray almost always. X-rays are normal in many, many shoulder conditions aside from arthritis. So if you have a rotator cuff tear, if you have biceps tendonitis, if you have shoulder instability or slap tear, all of those things are not going to show up on an x-ray. But sometimes what we'll see is we'll see small bone spurs forming off the shoulder bone, which can be indicative of developing rotator cuff tears or developing impingement syndrome. We can see arthritis at the acromioclavicular joint up here on top, and we can see arthritis developing between the ball and socket, and all of those things are helpful. So normal x-rays don't necessarily help us make the diagnosis, they just help us rule out a lot of things. What we do in the office that's very, very helpful, and this is something relatively recent, is we do an ultrasound. Everyone's heard of ultrasounds like women have for babies. There are lots of medical indications for ultrasounds, but we have a specific musculoskeletal ultrasound machine that we've begun using over the last year or so, which helps us actually look deep inside the shoulder, past the skin and past the muscles, beyond the bones and into the tendons and rotator cuff area to see what's going on. So it only takes about 15 minutes or so to do this. It's relatively inexpensive, it's completely painless, and it's been a great adjunct to our practice to be able to do this. So what happens is, if you're having shoulder pain, we examine you, we think we know what's going on, but we're not exactly sure, your x-rays aren't particularly helpful, we'll likely recommend when you come into the office right then and there an ultrasound of the shoulder. So we'll squirt a little bit of the ultrasound jelly right on the shoulder and put the ultrasound probe on, and we'll get a picture very, very similar to this down below. So this is the actual humerus bone. This whitish colored structure here is the rotator cuff. This is the skin way up at the top, and this is the space where the bursa sac would be in between. And we can tell really amazing things about the shoulder. We can tell from an ultrasound whether you have a rotator cuff tear. We can tell if you're developing a rotator cuff tear. You might have a partial tear. We can see fluid around your biceps tendon. We can oftentimes see the labrum, the cartilage that causes slap tears. We can see a lot of things with this. So this is very, very helpful, not only for diagnosis, but also if we determine that an injection might be helpful for you. The ultrasound allows us to put the needle exactly where it needs to go so we can treat the source of your pain. MRIs are very, very common. We do these all the time now. It's difficult to see a doctor, at least an orthopedic surgeon these days, and not get an MRI scan. I hate to say that, but MRIs is such an amazing technology. I mean, you saw the picture of the ultrasound, right? I mean, let's face it, it looks pretty cool to me, but it probably looks pretty fuzzy to you. I mean, that doesn't look like anything too exciting, but you get an MRI scan, and look how clearly you can see the bones. Look how clearly you can see the cartilage. This happens to be a labral tear, a slap tear. Look at this. This is the rotator cuff. Look how beautiful you can see the muscle and the tendon coming out to the bone. In this particular case, this is the torn edge of the rotator cuff. This end of the cuff should actually be attached down here to the bone, and all this white stuff in between is fluid, so this is a very, very large rotator cuff tear. That's what the MRI machine looks like. So if you come in, we do an x-ray, we do an ultrasound, things aren't looking like we really are getting all of the information that I need, I'll oftentimes send you for an MRI scan. It takes about 45 minutes of your time, but it gives amazing information in terms of diagnosing the problem and assisting me with treatment plans. So here we go. So when you have shoulder pain, we've sort of narrowed it down to the top 10 things that at least I see that cause shoulder pain. What are the different options for treatment? Many times we'll start with an anti-inflammatory. That would be the over-the-counter brands such as Aleve or Advil or Motrin. There are a whole variety of prescription brands of anti-inflammatories that you may have heard of or seen advertised on television. Celebrex, for example, Relafin, Lodine, there's a whole bunch of them. Shoulder, more than any other joint, I think, we'll do injections for because, number one, it's very, very accessible. It's very easy to get into the shoulder with a tiny needle for an injection. It's also very effective. I mean, if you have inflammation around your biceps tendon or if you have inflammation in your bursa sac causing impingement syndrome, we can deliver a small amount of cortisone injection directly into the area that's inflamed. We can use our ultrasound machine to do that, and the pain may go away, and that may be the last time we ever need to see you. So that's something that you might expect if you came in under the right circumstances. Physical therapy is a cornerstone of treatment in shoulder pain and post-operative care. Ron in the back can attest to that. You know, All of these things can cause pain, but a lot of them also cause weakness and muscle atrophy and stiffness. And until we can work through some of those issues, the pain's never going to go away. So our physical therapists are definitely the stars of treatment in a lot of these problems. And of course, the last resort is surgery. Many of these problems do well, many of them don't. And when they don't go well, we have to end up doing surgery on them. This is a picture of a typical ultrasound injection, ultrasound-guided injection. We'll use a small syringe, a tiny needle, and the ultrasound probe to help us get it in the right spot. Physical therapy, there's Ron in our sports center treating somebody with shoulder pain. So there are lots of different types of surgery. Many of these conditions can be treated with arthroscopy, fortunately. So in the older days, before arthroscopy had been developed, if you had shoulder pain and you had to have an operation, it would mean a 6 or an 8-inch scar on your shoulder. It would mean peeling the muscles away from the bone. It was very dramatic stuff. I mean, the outcomes were very good down the road, but there was extensive surgery involved, days in the hospital, extensive rehabilitation, and so forth. And fortunately, during my career and my experience, arthroscopy has taken over and become really the mainstay of our treatment for most types of shoulder problems. So arthroscopy simply means, arthro means joint, and scopy or scopy means scope, so we put a scope into the joint. And so that's about the normal size of a typical shoulder arthroscope. This is a person's right shoulder. This is the back of the shoulder. This is the front of the shoulder. We can make tiny little 1/4-inch incisions and put the scope in. The scope then, through fiber optics, projects the image of the inside of the shoulder onto a video screen that we can look at, and we can use different tools from different smaller portals around the shoulder to access the problem inside the joint. So it's really remarkable what we can do nowadays with a scope. Here's a picture of the inside of somebody's shoulder. This was a rotator cuff tear that had torn off the bone. We use different types of sutures to actually pull the rotator cuff tear back and repair it to the bone. This is a slap tear. We talked about that a little bit. This is the biceps tendon, the labrum that comes around. This is the upper part of the labrum that's torn with a small metallic probe showing the defect. We can put 1 or 2 or 3 sutures in that and tie it back down. This is a picture of an instability repair. If you've dislocated your shoulder, you may have torn the ligaments off the socket, and that's what's represented here by this sort of dark defect between the ligaments and socket, and we can put sutures into the bone all through a scope and tie the labrum back down. After surgery, I think surgery is the easy part. I mean, it's the part that I do, but I think the real work comes afterwards, and that's where the whole team that's sitting in the back of the room really helps out. Most shoulder surgeries take an hour or 2, sometimes longer, but that's just the tip of the iceberg. After surgery, there's a lot of rehabilitation that's involved. My practice is almost exclusively knee and shoulder problems, and I can tell you just from experience, knees are hard enough, but shoulders are difficult. So not for me, but for patients. Shoulders are difficult to rehab. It's a more complex joint. There's more anatomical variance between shoulders. There's a lot more going on. So whereas we can scope your knee and you're back to playing golf within a couple of weeks, the same isn't always true of the shoulder. So I'm certainly not trying to be pessimistic in any way about what we can do with shoulder arthroscopy and shoulder surgery, but just a realistic reality check that shoulder surgery on Thursday is only the start. It requires generally 6 or 8 or 12 weeks of physical therapy, exercise, and time afterwards before the shoulder starts to turn the corner and feel well again. We use a lot of different sorts of techniques. We use many times a sling after rotator cuff surgery or labral surgery to protect the shoulder so it's not injured when you're going to the grocery store or going to church or going out shopping. Holds the arm next to the side. We'll oftentimes use something called a CPM chair. This is an actual motorized device that helps us move the shoulder in different directions to prevent scar tissue. And aside from that, our physical therapists are very, very helpful. So that's just a brief introduction to shoulder pain. I hope that was somewhat helpful. This is a new talk that we've added just in the last couple of months, so I'll be refining it, hopefully based on your suggestions. And I thank you very much for your attention. I appreciate all of you coming out, and it would be my pleasure to take any questions any of you might have. So thank you very much.